Welcome to the CIO podcast on Healthcare IT Today. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging, and we want to help you be more successful. Today's guest is Pamela Banchy. She's the CIO and VP of Clinical Informatics at Western Reserve Hospital. Welcome, Pam.
Thank you very much, John. So glad to be here.
Yeah, so I'm excited to hear your perspective. I think you have some really unique perspectives, but before we kind of dive into the questions, tell us a little bit about yourself and Western Reserve Hospital.
Sure, be happy to. Well, I am a nurse, professionally trained. I've been a nurse for 38 years. I earned my way into the healthcare space after about 14 years, and I have been in healthcare IT ever since. I have been the Chief Information Officer at Western Reserve Hospital for the past 8 years.
Wow. No, that's awesome. And I think that's what's going to be really interesting is hearing that nurse perspective. But I think it's also interesting, the size and the setup of Western Reserve Hospital. So how has your job as CIO really been impacted by working at a physician-owned community hospital, Western Reserve Hospital?
It's a wonderful experience. I have had the opportunity and the pleasure to work in other non-physician-owned healthcare organizations. And I think the collaboration between physicians and nurses in general is very strong, and making it very easy in my role as a chief information officer to collaborate with the physicians. The goals and the quality aspect of the delivery of care, along with implementing technology and change, makes that a lot easier. Again, patient safety, our mission is all focused very collaboratively on doing the right things for the patient. So I think it's very easy.
Well, I think it's interesting that it's physician owned, but I think it's a for-profit hospital as well, so it's interesting. You focus on quality, but you also have to focus on profits, which that must be an interesting discussion sometimes as you evaluate different initiatives.
Yeah, it can be. But again, I think my experience in the time that I've been there is very logical perspective. So the technology has a presence in healthcare, obviously. And so as the needs change for healthcare, the technology adaptation needs to happen as well. I have been fully supported with myself and my department through the financial journey, if you will, of understanding what it costs to continue to have that high quality care that we strive to do and that we're very successful at.
Yeah. And there's something to say. I mean, with more profits, you can accomplish your mission better. So I think there's a balance that always has to go on there. I think
that's absolutely true.
Yeah, I think it is challenging as a community hospital. I mean, I think many of the community hospitals out there are really struggling. So what's your take on, are these community hospitals sustainable? And how do you look at like partnerships with these larger systems going forward? Is that going to be important, or how do you see that playing out for a community hospital?
Yeah, as a community hospital, obviously smaller. And where we are in Northeast Ohio and in the state of Ohio, there are still very viable, sustainable community hospitals. And we are one of those. We did recently enter into an affiliation with University Hospitals of Cleveland. And the purpose and the goals that we mutually have is for patients and developing various service lines for our communities. We are not a tertiary referral center. We are full service. But the collaboration efforts with University Hospitals of Cleveland will allow us to gain efficiencies for our patients and our patient-centered care between the organizations and a close community. So we're very much looking forward to that relationship.
Well, it seems like that would be a requirement, right? Otherwise, your patients might look other directions, or or at least you wouldn't be able to provide the care for them. Is that how you kind of look at it? Is like, we can't support this many service lines, so we need these partnerships?
Yeah, certainly there is collaborative efforts, and as you mentioned, we are full service, but there are service lines that we currently don't provide as a community hospital, and that's where partnering with a larger hospital in a relationship will certainly benefit both organizations from a collaborative perspective, but primarily the patients. They can obtain services that's high quality in both organizations in a very closer proximity, if you will, because the geographic location of the facilities and where treatment is offered for individual needs of patients is very specific. So this will at least, allow that collaboration to happen.
Yeah. Has it allowed you to be able to be more collaborative from an interoperability standpoint as well? It seems like that would be something patients would really want to see because they're probably going to the larger hospital if you don't offer that service anyways. And the ability to interoperate that data and things like that. Are you exploring those options as well?
Very much so. Interesting that you say that because that is just where we're embarking on our relationship. So from the technology perspective and keeping the patient focus centered, but how do you exchange information between organizations that are disparate? You have disparate information systems and you have the patient focus. So right now we are getting engaged with the university hospitals on a collaborative tools, both to and from our organizations for information sharing, interoperability, as you mentioned it, and then how can we make that efficient for the patient? Because at the end of the day, it is all about the patient, making sure that the right information is in the hands of the provider at the time of treatment.
Yeah, that's great. So let's talk about your nurse perspective. I think it's not very often, at least for me, maybe some others that I'd love some intros, but it's not often that we see nurses become CIOs. Do you think, more nurses should become CIO, and what unique perspectives do you really offer with your nursing background?
I'm very fortunate in that I did not wake up one day and decide that my career path was going to be a CIO.
Yeah.
And so I guess, to jump right to lessons learned for anybody who is in healthcare and has leadership attributes and interests, when opportunities come up, don't hesitate to take advantage of them. And, and that's exactly what happened for myself. I moved into a management position, then I went into IT, and then it just as every opportunity came, I took advantage of it. I think having a clinical nursing background definitely positions anyone to be excellent in the role of a chief information officer. I was hesitant to enter into this role because of my lack of formal technical training. And I focused on my leadership attributes, if you will, and my training, and surrounded myself, and I still surround myself with people who can do the job that I can't or shouldn't from the technical perspective. So it's really about the leadership, and it's also about understanding and communicating, collaborating with physicians and nurses and any healthcare team members, because that really is the key to the role. It's communication, it's listening, it's putting the patient first. And that really, I think, was very easy for me as I went through, and I'm still, functioning in a nursing capacity, but you learn to listen, you understand what the patients are going through, and you also understand what the care team is going through. So there's empathy on the part of how I believe I execute my job, and understanding what the priorities are and how to remove those roadblocks, and also to educate my team who might not have that experience themselves, but more of a technical. I believe that I can translate that and transform that for them as well.
Yeah, I mean, you obviously have some unique leadership skills, but I find it fascinating that you said you were hesitant about that. I have a feeling there's many nurses out there that probably feel the same way. And I think there might be some gender challenges here as well, right? Where, we've seen the same issue in many jobs and careers, or even speaking engagements for our conferences. We ask a man to speak and they say, sure, of course, whether they're qualified or not.
Right.
And then I've often asked women to speak and they're like, well, let me check and think, and I'm like, why are you hesitant? Like I asked you because I knew you were qualified, right? And there's certainly some other dynamics at a conference, but do you think some of that contributed to the hesitancy, is kind of maybe some of those gender issues as well?
It could be. I mean, I did all of the or previous jobs that I had, the CIOs were all men. But there were two specific professional organizations. That's the other thing that I would say, if anybody is thinking about it, join CHIME, join, HIMSS, et cetera, because the leadership and the collaboration in those groups. When I joined those organizations, I initially took a little bit of a passive role, but through some examples and mentors that I quickly affiliated with and became friends with, it became clear to me that it's gender agnostic, as long as you can do the job. And then again, following up on the leadership. But there are, through professional organizations, the mentoring, I did find a couple of very strong mentors that helped me to continue to feel that confidence in order for me to move forward. So I'm very confident today.
That's great advice, and hopefully people listening to this will inspire some other people to have the confidence you did and be brave. So thank you for sharing that.
Sure.
We can't have a conversation without a little COVID, right? So what are some of the challenges you've had to navigate during COVID, and how do you do it given some of the budget constraints you have, as a community hospital, physician-owned, for-profit, how have you approached it, and what are some of the challenges you've had?
Yeah, I think we were very similar. We are very similar to a lot of other organizations. Our number one challenge initially was being able to have our patients communicate effectively with their family members. And so one of the things, we got very creative, and we went out and purchased iPads and iPad minis, and we made those available to our patients. And we were able to install Zoom on those devices and allow the physicians and the family members to actually communicate. And that was a big positive for our patient population and our visitors. And so it was not a lot of effort. It wasn't a big lift, if you will, but that was one of the quick wins that we had.
That's awesome. And do you see that going forward, that's going to become part of the fabric of the organization, or how do you see telehealth and those efforts playing out longer term?
Yeah, so telehealth was another big lift with COVID, along with the remote workforce. Those were two other areas that quickly became apparent that we had to mobilize forces. The other thing I will share is almost everybody dealt with the same thing, is how do you mobilize the forces, if you will, and get things. We moved a workforce to remote locations in a very short turnaround time. That put strain on resources, that put strain on how do we get equipment. And so we had to get very creative with that. And that was to meet the demand. Telemedicine, our percentage of use of telemedicine by our patient population and our physicians was low, very low initially. And then it quickly went above 50%. We're somewhere sustaining a level that I think is a comfort level for both the providers and the patients. Patients are still hesitant in some degree to come into the office for a visit, so telehealth still has a presence. I think that's going to be sustainable going forward as well. The remote workforce remains working remote. Those that have been working for almost a year now will continue to work remotely as well. We also recently are a vaccination center. So we have been able to operationalize, if you will, vaccination clinics for not only our employees, but for our community. And that's been a very big collaborative effort across the organization.
Do you think that the remote workforce is going to help you with the recruiting side of things as well? Because I've heard from a lot of community hospitals that it's like, how do I hire someone because they don't want to move where we're at? So are you going to leverage that in your recruiting efforts?
We're evaluating it. We do have some requirements that, from a preference perspective, to have people available to come in, because we think there's truly benefits to having face-to-face meetings and conversations, et cetera. But we recently had a position posted, and within a very short period of time, we had 24 candidates apply. It was in the security space, and they were people from 5 or 6 different states, and they were very interested in remote workforce. Unfortunately, we weren't able to move forward with that opportunity. There's many variables for that. We were able to successfully hire from within the state of Ohio, but yes, it is out there.
It's funny you say security. That's the number one biggest, most challenging recruitment effort of a CIO, I think, because there's just not enough talent out there.
Yes, that's what, security used to keep me up at night, not that it doesn't anymore. But I, again, have been very fortunate to have the support of the organization, the president, the CEO, and the CFO to allow me to develop a security program that is continuing to strengthen who we are and what we are from a standpoint of security. It's not really a matter of, if it happens to you, if you were to have a security incident, it's a matter of when. And again, the talent is out there. It's very difficult to find good talent. The tools are out there. And the cybersecurity aspect of the job has definitely increased. And that's one of the areas where, hiring good talent to keep you strong as an organization, to protect your assets, and your patient information assets is key. So, as a CIO, one of the things that needs to continue to evolve is information gathering as to the trends, keeping up with the trends and the technologies. I'm also a certified project manager, so balancing all those balls, if you will, in the air, and making sure that you can do the best that you can with the resources that you have and the time that you have to get things done. So it's an art form.
Yeah, it's great that you were able to get the board's support for security. I know some that are still struggling with that. Was that something you had to do proactively, or was it just the rising number of ransomware incidents and downtimes, et cetera, it kind of got your board's attention, or was it a mix of the two?
Yeah, I think it was a mix of the two, but primarily we do our due diligence around security. So, every year we do a gap analysis. We use a security risk assessment tool, which is provided by the government, which is very in-depth and detailed. And we take the results of that and we look at the gaps and we say, oh, wow, when you do an internal analysis of your own and you have the right resources internally to say, I think this is where our focus needs to be and this is why. And again, it's managing and monitoring the trends and where are the cyber criminals? Where are they targeting? Are they targeting, phishing campaigns? Are they targeting the network? Are they targeting, all the above? And then you look at where you have gaps, if you will, in protection needs. And then that's when you put your plan together. And so, understanding where we were and where we wanted to be was really an asset to be able to take that forward and to get both the board and the backing of our executive team and financial support. So
awesome. And so did you just do that internally with the tool from the government? That's impressive.
Yes.
Sometimes it's also hard for people to stare themselves in the face and be honest.
Well, I think you do need to be honest. And I think it doesn't do anybody any good to not look at your own self. It's, I think, sometimes harder to have others look at you, to be honest with you, because then it's a matter of, well, I don't think we look that bad. I don't think we have those problems. So, when we really allow and trust ourselves to be very transparent, that's another thing. The culture at Western Reserve Hospital is all about supportive and being transparent. And so, through the transparency of being able to put it out there in front of the organization that this is where I think we really need to spend our time, our money, and these are the tools that we need to do. There was a lot of support for that and trust.
A beautiful lesson around supporting transparency and being supportive rather than punitive, which is how I would describe some organizations.
Yes.
Yeah, that's great. So what's been, key to your success as CIO? Are there some key attributes you think that you're like, yeah, this has helped me become successful?
I would say listening, number one, being attentive to the needs around you and the needs of your team. And I had somebody in one of my previous jobs said, don't be an office leader, getting out, being around people, understanding what their challenges are. Empathy, I think that certainly helps provide the support and understanding as well. So, active listening, put yourself in their shoes, being able to depersonalize the situations and the struggles, because there's frustrations with trying to deliver the best care that you can. So the clinical staff and the supportive staff, they're frustrated in their day-to-day. So, just taking a step back and understanding what the real issue is very helpful.
It's all about the humans, not the technology, huh?
Right. Yeah. And it's collaboration.
Yeah.
Open collaboration and discussions.
So what advice would you give someone? I know you've given a bunch of great pieces of advice here, but anything you'd share with other CIOs or maybe even some aspiring CIOs and maybe some aspiring female CIOs who want to be like you, or maybe some aspiring nurses. I think there's a lot of people who would look at you as an inspiration. So any thoughts of advice of things they could do, or, even maybe some that are already CIOs as well?
Yeah. First, I would say be confident. Believe in yourself, know your strengths, know where your opportunities are. And if you have a passion to be in healthcare as an executive and a leader, then you should pursue that actively and surround yourself with people who complement you and that can help make you better and make your whole organization better through collaboration and learning from each other. I have learned so much from my team on the technical side that I didn't know. I just learned that by life experiences. And so I respect and appreciate them very much. And I thank them for what they have taught me because they've been patient with me through my learning journey. So, it's out there. So don't be afraid to go get it.
Yeah. I find it fascinating that you said, find people that complement you.
Mm-hmm.
And I think you probably meant it as that complement your skill set. But I think maybe there's a double meaning of people that will complement you, that will support you, that will have your back, that will help you understand and have the confidence. Is that true? Is that a good double meaning or no?
Yeah, no, it's very true. And so, you have to be, we work, and interact with people probably 80% of the time. And so, there's work families and there is truth to having a work family, whether that's your peers, your team that you lead, your colleagues that work beside you. And so, understanding and developing those trusts and those collaborations, I think is a very big, significant, part of the job. And so, having those and surrounding yourself with those people as well. They know you, you know them, and you complement each other. I certainly know who on my team I can rely on in certain situations because they complement me. If I'm not strong in an area, I will certainly bring them in. So
yeah,
yes, it's both.
I was interacting with a friend who said, how do you deal with imposter syndrome? And my reply was, I surround me with people who believe in me more than I believe in myself.
No, that's very good. That's true. Yeah, that'd be very true.
Excellent. Well, I appreciate you taking the time to sit down with us, Pam. This was a really educational episode. And thanks everyone for watching and listening. We appreciate all your support of the CIO podcast on Healthcare IT Today. If you want to find more great health IT content like this, be sure to check it out at healthcareittoday.com. Thanks, Pam.
Thank you very much. Thank you very much, John. I appreciate it.